Hi, I'm Justin. This is your latest episode on mental health and addiction and everything that goes along with those things. I wanted to follow up on my last episode, episode 3, that was regarding what sobriety means for you. I wanted to add that, excuse me, remember you have to do what's best for yourself. This can be difficult when it means avoiding people or friends or others who are in some way unsupportive or possibly don't know how to be supportive. Some people may be toxic for you. You can still have a relationship with some of these people if you want to, namely if they're not drug users. That's different. That's very toxic. You can still have a relationship with family and friends even if they don't know how to support you. Keep in mind that they don't know how, most likely. It's very hard to get through that sometimes, but try to keep that in mind. Remember that when you change your boundaries, what is okay for you? How far can someone go with you? How well will you have someone treat you, or how poorly will you let someone treat you? Those are your boundaries. And when you change your boundaries, it is jarring for others around you, which you'd think would be kind of weird, and it is weird that you'd think they'd recognize you're getting your self-respect back. But it can be taken as, I guess, an act of hostility in a way. But it's a misunderstanding when you no longer allow people to cross these boundaries and they become offended at that. Do your best to explain that maybe before that were to happen, that you are redrawing your boundaries because you are trying to have some more self-respect. And if there are people who are close to you and understand that, they should support that, and I believe they will. It may be difficult, but help them to understand it, even if they were unable to help you. A lot of people truly don't know what to do, and I'll get to more of that later. If sobriety means X, we'll say X means what it means to you, and it works for you, awesome. But everyone's different. Everybody is different, with different health issues, and sobriety, will not look the same for everyone. That's just not a reasonable, it's just totally unreasonable. It's not reasonable to think it's going to be the same for us all. Not reasonable, not realistic. You don't get the same health treatment or mental health treatment from the doctor. Even if you have, even if two people have cancer, they can be treated very differently for that same ailment, depending on the type, location, and stage of cancer. Just I know it's a very different illness, but I'm just drawing an example with that because a lot of people can't understand cancer. That's why I used that. I apologize if you've had trouble hearing me. I am going to try to speak up and speak slower. And I'm also going to try not to cover the microphone, as I mentioned before. Your reasonable view of sobriety is fine. As I've said before, if you're taking something to get high. But if you're on a maintenance program, including Suboxone or methadone, I support that. I also support trying your very best to get off of those maintenance programs within a few months. I know a lot of people say that they just can't do it, and if they can't do it, they can't do it. That's all right. But if you can, try to get off of it. If you still have pain problems, there are other things to do. Like I said, your reasonable view of sobriety is fine and can change over time. You're doing this for yourself, no one else. So remember this when you're long sober, when you yourself are long sober, and remember how you felt and dealt with the difficulties of getting through detox and withdrawal symptoms while you dealt with pause and everything else while you were starting recovery, and others who have been in recovery or consider themselves recovered if they've been sober a long time. I encourage them also to take the meaning of sobriety as someone being able to function and not, have negative impacts on their life, because there are medical treatments for this now, and maybe there weren't a while back. Some of them are pretty rough treatments, but it is better than getting your drugs on the street. Taking it orally, it's just safer. They are still technically an opioid or opiate addict, but they are not a street drug addict. Technically, they are addicted to it, but sobriety itself can mean, when someone acts sober or acts intoxicated, it can be the opposite of intoxicated. So, methadone is typically not an intoxicant. It never was for me. Suboxone, the same. I never got any euphoric feeling off either of those. I've heard that people can, but I just you know what you're doing, and if you're doing it for the right reasons, and whether you're doing something or not, you're not fooling yourself. You may be fooling the doctor or something, but you, again, have to do this for yourself. But it's better than doing street drugs. And like I said a moment ago, I've noticed that I may be speaking a little too quickly and or quietly at times in my videos, and I've also noticed that I may have accidentally covered the microphone at times on my new device here. I will correct the intro videos later, and I'll work in the meantime on trying to keep the mic uncovered in my hand and be sure that I speak clearly and not too quickly. And I would also like to know of or hear about how your mental illnesses or illness has affected your addiction, recovery, or any time in between. I do want to start a discussion with a little bit of back and forth. I know I may only have 1 or 2 subscribers at the moment. I'm hoping to get a little bit more because of the transition, but I really do want some feedback so we can talk about something, and I really just want to be able to help as much as I can. I feel like my experience has taught me a lot, especially about the niche that I speak of, in which people fall into a category which I feel is not being addressed by mental health society properly, and that is the people who fall into the comorbidity of, which is more than one illness, of mental illness of some kind and addiction, and how that plays out. Anyhow, I would like to know about how that affects you. And I am going to be writing my autobiography as soon as I get the things I need to know about writing, specifically an autobiography. I've never done something like a full long book before, but I will also talk a little bit about my story, if you will, for lack of a better term, mainly discussions of how difficult things can feel when you're even seeking help, but the help you get is anything but helpful, at least for you. Because you may, as I previously mentioned, fall into this category of people where help, along with tough love, which often is where people end up after a while, with people who, care about them. They just feel like, oh, I can't handle it anymore. We're going to do the tough love thing. And it's really can feel like a cutoff, like a give up to a lot of us who have mental illnesses, and maybe to people who don't. But I know for sure people with mental illnesses have a much more difficult time comprehending that, and possibly just this period doesn't make sense. And I may be one of those people. However, going on, I do intend to write my book and talk a little bit about my story. I won't be mentioning my whole book on here, obviously. And as I said, mainly discussing how things can feel when you're seeking help and it feels like you're not getting help, or if there's a tough love situation where that's the kind of help that I guess you're being offered and it is just not helping you. Many of us are totally unable to reconcile such words being used together as an actual term or thing. No, I believe that the tough love model is more harmful than anything for especially our mental health and addiction patients who fit into this niche. I do. And I was once told this by an ER doctor, and he helped me after my opiate and heroin overdose and during an injury with rhabdomyolysis. This is an ER doctor that told me about this. The addict is not blamable. You can't blame the addict for being an addict. And it may sound like a very convenient excuse, or maybe even to some current and former or recovered addicts or addicts in recovery, it may sound like a convenient excuse because this medical view that it is a disease may not have been around before, and they may just think it's a bunch of BS, hogwash type stuff. But I've really I have read about it, and I fully understand that addiction is a disease. It's a disease that wants you to keep using. Otherwise, it will force pain, depression, the most horribly nauseous and back-to-back vomiting and diarrhea, shitting all over yourself, vomiting all over yourself, depression and just gut-wrenching pains and shakes, and it can also cause, for me, my heart stopped thrice. That's 3 times in an ambulance on the way to the hospital once. And most people who have not been there or can't really realize what that detox and withdrawal will do to your body, your mind, and even your will to live and motivation, not to mention health, and how it crushes you totally. Withdrawal and the symptoms and how it feels crushes you totally. If you can get through it, it crushes you totally whether you get through it or not. But it's best to just get through it because it still crushes you. As I said about my heart stopping, it actually happened many other times as well, and I just didn't know what it was until when I was in the ambulance it happened, and I realized, oh, that's what that was. Whenever I can't move at all, like I could be standing up and it would just totally collapse and my heart had stopped because I was detoxing when I had nothing to take. Anyhow, that was scary to realize. As I said, it happened many other times as well, and I truly have come within the grasps of, you could say, the event horizon of death, with my life flashing before me, very quickly, but also pretty clearly. As quick of a snap of a split second of it was, or is. But as I said, I've truly come close to death more times than I could even really recall. I've been very scared. I've very nearly pissed my pants before when I was 19, but that's another story. Guys, I really want you to tell me about what sobriety means to you. Tell me what your addiction feels or looks like to you, if you can say or explain it. What does your addiction feel or look like to you? What does your recovery feel or look like to you? If you can explain that. Whatever process or stage you're in, please explain it. I would love to hear about that. What does it feel like? What is your feelings about any types of legal maintenance programs, such as the aforementioned Suboxone or methadone programs? I personally do take kratom. I do have chronic pain problems, and I also have my medical marijuana card. What are your feelings on things like that? Since it is now used as medicine, does that change your view or how you classify it in your own mind of marijuana or something like kratom? Do you classify it as medicine now, or do you classify either one as medicine or either one as drugs or other? And if so, I would love to hear why. I'm not trying to argue with anyone or anything like that. I'm just very interested to hear people's thoughts and views on this. So it's not a trick question. If you need any help, even just doing one thing which may have you feeling completely overwhelmed, Google social workers near me or go to the website of your insurance provider. Find your in-network social worker type help. You can search for that. Or ask your insurance provider for a case manager for help, even if they can only do it for you in one evaluation, which is usually when they send someone out to evaluate you to your home to see if you need help with anything in a home. And if you do, they can assign someone to come out to your home regularly. If they feel that you do not need that, they will help you with what you need there and possibly on a follow-up visit. But that's what I had to do, is I had to get a one-time help thing. But be sure that you do have a great social worker, when you do get one, who works as your advocate to proactively find ways to continually help you, as well as helping you with the normal things that they would be daily helping you with on a regular basis. Definitely. All right. Reliable information is absolutely everything. I want to give you guys some resources to go to in this time of a little bit of misinformation. I'll give you there's 3 websites. Sometimes they ask for donations because they are unbiased and they're organizations, but they are reliable, unbiased fact-check websites. There's factcheck.org. That's factcheck.org. There's also www.politifact.com, politifact.com. And realclearpolitics.com has a fact-check review. If you go to realclearpolitics.com/fact_check_review. But I definitely recommend factcheck.org and politifact.com. Now, if any of you are wondering about the stimulus checks, go to the irs.gov website, irs.gov/coronavirus, for the actual, factual information that is the most up to date. The tax filing deadlines were extended to July 15th, but the IRS urges those owed a refund to file as quickly as possible. but reminds everyone that they are eligible to request an extension if necessary to file their returns. That means you still need to request the extension. It's not automatic. The Coronavirus Relief Fund / stimulus package, also known as the CARES Act, is actually a tax credit, meaning you will not have to repay it. And it's being issued now, because of the emergency, ahead of the 2020 tax season, which would be next year. I recommend everyone use the IRS freefile. You do not have to pay to do your taxes. You can use IRS freefile. It's on IRS website. IRS freefile. Just Google that. Okay, a little bit more about stimulus checks. There are reasons it could be delayed, but everyone who falls under the income brackets does get it. That could be delayed unless you owe back child support that is in excess of the amount of your stimulus package and or tax refund if you do it that way. Unemployment. If you are unemployed and you're already on unemployment, that is your stimulus because it is increased. The unemployment benefits have actually increased, and that is actually a better deal than the one-time stimulus payment so far anyway. $600 a week. I don't know if that's an increase of $600 a week on top of or what, but it's basically $2,400 a month. Not bad. Most people don't live off of that. That's really a good thing. And that should be what people live off of. This is like basic amounts that you can actually live off of. It's ridiculous for people to live off of $7.25 an hour in some states. Haven't gone up in 11 years on minimum wage in Texas for sure. So, Social Security recipients, the IRS website says no action is required for most people who are on Social Security or Social Security disability. But IRS website will have that information. And I would like to get a topic of discussion going for anyone who has any questions relative to the channel, this YouTube channel topics. The topic of the information is mental health, addiction, and everything that goes along with that. I described that a little bit more in some other videos, but it's mental health, addiction, poverty, relationships, communication, mistakes, self-respect, all of that stuff that gets damaged in addiction that needs to be addressed. We talk about all of it. We talk about life and coping skills. But I do need a little bit of interaction from at least one person. Somebody, don't be shy, please. But ask any question you may have, even if it's just in a comment. I'll do my very best to provide the best and most accurate information and factual information. And if I don't know, I'll never just avoid your question or provide false or less than accurate information on anything. I will provide the best information to the very best of my abilities. Heck, we've got fact check websites. No excuse. But I do pride myself on knowing when I really know what I'm talking about, but I'll provide the most accurate information and up-to-date information. And in the unlikely event that I do make a mistake, but I gotta say this. In that very unlikely event, I would both acknowledge and correct and update that mistake. I am actually only one human right now with very little resources and just one Android phone. But I will do my very best to provide accurate and information in every video that I do. So please comment with questions. A lot of this stuff could have been avoided. This coronavirus stuff could have been avoided. We were warned by many people that we have leadership that has actually mental health disorders himself. And I'm not saying I would qualify to be president, but I'm certainly more reserved, and I believe that I could do a better job than him. Not that I would qualify, but heck. And him, you know who I'm talking about, and I hate getting political here, but there's been, just last year, there were 9 different doctors, professors, and psychiatrists who tried to basically, there was over 300, those were 9 that were most prominent. There were 350 psychologists and mental health experts who were sounding the alarm that the president's mental state was deteriorating, and it was time to begin hearings to study if he was emotionally and mentally capable of serving in office. I'm not saying any of this stuff because of any party affiliation. This is an emergency situation we're in right now, and we have some incompetence at the top, and a lot of it. Please use your votes wisely. Check PolitiFact, check your factcheck.org, and learn about who you vote for. Learn about what they truly support, and be open. Please be open to maybe having a new view, especially in times like this. Please subscribe to my channel. Thank you so very much for watching. Again, please interact with me. I would love to have some questions that I could talk about and look up something for you if I could. I'm willing to answer any question you may have about my view on anything, but I'm going to try to keep it as on topic as I can. However, because of policies, I do have to discuss some, political stuff, which I will try to avoid for the most part. But I am generally pretty political, so I will have to inject sometimes here and there. But please be patient with me. If you do disagree, you can feel free to comment, but I'm not here to argue with anybody. Hostile comments will be removed. This is a place for everyone to be understanding and accepted. And again, please subscribe and share this mental health and addiction YouTube channel. Thanks.